My name is Dr. Ellis Johns, and I'm here to discuss a very common health problem that many of you probably either have or at least know somebody who does have. The health problem I'm going to discuss is high blood pressure, otherwise known as hypertension. Just over a quarter of Americans have it, and it becomes more common as people get older. But just because a quarter of Americans have it doesn't mean it's not worth taking seriously. For starters, your heart requires blood vessels to keep pumping blood to the rest of your body. One reason for it to stop pumping blood is something called a heart attack. Having high blood pressure directly increases your risk for having a heart attack because it changes the blood vessels that supply the heart. And over time, those blood vessels, also known as your coronary arteries, can change. And that change decreases the blood supply to the heart, resulting in a heart injury. High blood pressure can also lead to brain damage. This can be due to a change in the blood vessel walls that lead to a decrease in blood flow to parts of the brain. Other times, the high blood pressure results in a ballooning of a blood vessel, and if the blood vessel wall has a weak spot, it can burst open and bleed into your head. In either case, blood with oxygen isn't getting to the needed parts of your brain, and the result is something called a stroke. And while strokes can be due to many other factors, hypertension is definitely a major contributor. Strokes can result in brain cell death, and at this point it's largely irreversible. High blood pressure also affects your kidneys, those bean-shaped organs located close to your back on either side. What the kidney does is it takes your blood and it holds on to all the stuff you do need, and it gets rid of all the stuff you don't need, like toxins and such. And then it makes sure that all that stuff you don't need ends up in your urine, and then of course you void it out. But prolonged high blood pressure severely damages the kidneys. It's kind of like taking a hammer at your kidneys on a regular basis and pounding and pounding and pounding. And we see these changes in the kidneys. They become smaller. They don't do their job as well as they used to. And then sometimes this results in kidney failure, meaning you don't make urine and you can't get rid of the stuff you normally would. So that means toxins tend to build up in the blood, and your body slowly gets poisoned. So this is probably a good time to reiterate that every part of your body needs blood, and that blood is supplied by a blood vessel. And high blood pressure affects those blood vessels. So that means every part of your body is affected in a negative manner. And the constant pounding of that high pressure in the vessels results in changes in these blood vessels. And changes in these blood vessels mean that blood doesn't flow as well or as easily as it once did. So a few of you are probably thinking, well, if I have symptoms of high blood pressure, I'll go ahead and see my doctor. But there's almost no warning signs for most folks that they have high blood pressure, and they typically don't know until something really bad happens, like a stroke. It's analogous to your car driving on the road, and all of a sudden the engine just blowing up, and you're wondering what happened. Your car sounded the same it had for the past 10 years. Perhaps you forgot to change your oil, or you never changed your oil, and now your engine's blown up. In the same way, you without adequate blood pressure control results in bad stuff, as we mentioned earlier. So now you know about the bad stuff that can happen from high blood pressure. You know that there are very few warning signs or symptoms of high blood pressure. So the next question you're probably wanting to ask is, what can you do to avoid all the bad stuff from high blood pressure, and how can you tell if you have high blood pressure? Well, the first step is to have your nurse or doctor check your blood pressure. We use something called a sphygmomanometer. It's basically a cuff that goes around your arm, and first thing it does is it inflates, or we pump it up. That then closes off the one of the major arteries, usually your brachial artery, and then your nurse or doctor slowly releases the pressure in the sphygmomanometer until they hear a loud thump. That thump is known as your systolic pressure, or SBP, we usually abbreviate it as. That's that top number that you see. Your doctor or nurse then continues to release the pressure in the cuff until there's no longer a thumping heard, and that is known as your diastolic pressure, or DBP. It's the bottom number that we talk about when we tell you what your blood pressure is. Both these numbers are important since they are both measures of your overall blood pressure. To make a diagnosis of high blood pressure, your blood pressure has to be elevated on two separate occasions. Specifically, your systolic blood pressure has to be greater than or equal to 140, and your diastolic blood pressure has to be greater than or equal to 90. Now let's say your systolic blood pressure is somewhere between 120 and 139. If you're like me, you're probably thinking, fantastic, my blood pressure's less than 140, so I must be completely healthy. Well, in general, our blood pressures don't tend to go down as we get older, so this is what's known as pre-hypertension. Pre-hypertension is a bit like a shot across the bow. It basically says you don't have high blood pressure, but if you don't make some changes as you get older, you most likely will. So if you have high blood pressure, how and why did this happen? Well, the short answer is it's complicated, but there are some primary reasons, like increased salt intake, or smoking cigarettes, or having lots of excess body weight. Diabetes increases your risk for high blood pressure, and even some of the medications we put you on can raise your blood pressure. There are also secondary causes, like adrenal gland abnormalities, sleep apnea, and renal artery stenosis, meaning the blood vessel to your kidney is narrowed in some way. Some folks were genetically prone to have high blood pressure, and it turns out their daddy had high blood pressure, maybe their mom had high blood pressure, and their kids will probably have high blood pressure. But in general, it's not clear-cut. Usually it's a combination of all these different things. But there are things you can do without medication to prevent high blood pressure or treat it if you have it. One option is adopting a specific diet, like the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. The diet was developed by the National Heart, Lung, and Blood Institute, which means your tax dollars paid for this diet's creation. It's a diet which is high in fruits, vegetables, low-fat dairy products, as well as reduced sodium and fat intake. It can result in a greater than 8 to 14 millimeter mercury change in your blood pressure, which for most folks is all they need. And one of the best side effects of the diet as well, it also results in a healthy weight change as well for most folks. You can learn more about the DASH diet by going to dashdiet.org or just Googling the National Heart, Lung, and Blood Institute's DASH program. Another good option to prevent or treat high blood pressure is smoking cessation. It's getting harder and harder to smoke these days and more expensive. There are also fewer and fewer places to go to smoke. So it makes a lot of sense to make a change now. And if you're thinking about making a change as far as quitting smoking, definitely talk to your doctor. There are some things we can do to help. And if you already tried a number of times and are still smoking, keep in mind that most folks tend to try and quit at least 10 times before they're successful. Another option for lowering your blood pressure is exercising. So engaging in aerobic physical activity, for instance brisk walking, for at least 30 minutes a day, most days of the week, can result in a 4 to 9 millimeter mercury blood pressure change. And once again, that's all most folks need to keep a normal blood pressure. Also important to keep in mind is these lifestyle changes are additive with regards to your blood pressure. So you're likely to achieve a lower blood pressure if you quit smoking and start walking and make diet changes as opposed to if you just quit smoking. The next thing is to talk to your doctor. Remember all those secondary things like the renal artery stenosis or the adrenal gland abnormalities? Well, your doctor will know if you're at risk for those sorts of things and can test you for them. And keep in mind, those sorts of things, if you don't treat the underlying cause, they don't tend to go away, and a lot of the other changes you might make won't be helping as much as they possibly could. So if you tried all these non-medical interventions and you've talked to your doctor about the secondary risk factors, you're probably going to need to be put on a medication. There are lots of choices, so this means you'll need to talk to your doctor about your goals and about the different side effects before you start on a medication. And finally, there are other alternative things you can do, like stress reduction, meditation or prayer, diaphragmatic breathing, getting the appropriate amount of sleep, or just changing your environment that can also significantly impact your blood pressure. So this is a brief overview of high blood pressure, what it does, why we screen for it, and also how we treat it. If you have any more questions, definitely talk to your doctor. This is what we go to school for. This is what we should know a whole lot about.